Hi there. So I'd like to spend a few minutes talking to you about fat transfer. So fat transfer in our practice is an extremely versatile and commonly used procedure to restore volume. So let's start by first talking about what happens to the face as it ages. Basically, once you get into the late 30s and early 40s, what you start to see is that there's areas of the face from the top down that start to lose volume. Common areas are underneath the eyes, actually above the upper eyelid and brow area. The temples start to sink in, the cheeks start to deflate, you start to lose a little bit of the height of the bones over the outer parts of the cheek. You start to see some hollowing around this area in front of the ear. This part of the cheek starts to lose a little bit of volume, down around the mouth, the lips, and even the upper nasolabial folds, and even along the jawline, actually, both the front part of the jawline and the back of the jawline. So I just mentioned a number of spaces around the face that start to lose volume with age. And why I stress that is because, you know, when we think about volume replacement, we hear all sorts of things about fillers and different things like that. But when people restore volume using fillers or even some of the other types of fat transfer techniques, they're really looking at just a few areas, you know, whether it's a nasolabial fold or whether it's just the cheek or even just under the eye. But unless the entire area gets, you know, properly re-augmented with volume, then what ends up happening is you start to highlight certain areas, meaning that, let's just, for example, say you fill it into your cheeks or around your eyes, well then all of a sudden your temples start to look really hollow, or the area below the cheeks start to look really hollow. And this is that look that you see where people get kind of that chipmunk look and a natural fullness that just don't look like themselves anymore. So the way I do fat transfer, and why I love it so much in my practice, I do it as a comprehensive approach. So I never think of it as just a few different areas that we're treating. We're treating, for the most part, the entire face. So every area that has lost a little bit of volume, those areas that I mentioned, get a little bit of fat. Now that's not to say that you're gonna come out of this thing looking like a basketball, big round face. No, it means that if there's a hollow, a concavity in certain parts of the face, we're just gonna fill those concavities to where they become a little bit fuller. We're shooting for somewhere around 80% of the volume that you once had when you were younger. We're not trying to make you look 18 or 20 again. Quite frankly, most people look their best when they started losing a little bit of volume, somewhere in their mid-30s actually. So, you know, that is kind of a target for where we want to be. And then as you age, because this fat is now coming from, you know, your stomach or your outer thighs, those are the areas that we normally harvest from. When we take it from those areas and we implant it into this area through an injection technique, which I'll discuss in a moment, the beauty of that fat is that with age, the stomach fat or the leg fat doesn't go away with time. So now you're taking a fat that is basically, for all intents and purposes, is completely resistant to normal aging. And that's what makes it so special, because it creates a buffer with normal fat loss that's going to happen anyway. And now you're taking fat that's not going away with time. So basically what you have is a permanent, stable foundation of volume that is going to be stabilizing the shape of the face in the long run. So how does it fit in with the other procedures that we do? Generally speaking, we use it as a standalone procedure for people who've lost, you know, facial volume and they look a little gaunt and hollow. Usually the end result of that is they look tired. And then we complement our facelift results with fat transfer to establish the nice three-dimensional contours and create that healthy look that happens when people have fullness in their face. Because remember, when we think about the skeletonized look or the aged look, those are people who've lost a lot of volume. So what we're trying to do is restore that effect and create a nice, healthy, you know, vibrant looking face that we see in the younger patients. And then we use it extremely commonly, almost in every case, when we're doing eye rejuvenation, whether in combination with blepharoplasties or skin pinches or any of those other procedures, because an eye just doesn't look refreshed and vibrant if it has big tear troughs and hollows around it. So it's an incredibly versatile procedure in our practice. I expect the fat to last basically permanently. What I also expect is for you to have one procedure done and not to have touch-ups down the road. That's been the case for the last 11 years. 99.99% of our patients get a single procedure and don't need to do it over and over again. The other aspect that's extremely important with it is that fat gets better as time goes on, because there's an influx of stem cells that are transplanted at the same time. So those stem cells start to really rejuvenate the tissues, and there's a ton of science that's been done for that purpose in and of itself for like joints and different parts of the body that are being treated for disease processes, etc. that stem cells can really restore. So when it's used in the face, it creates a more youthful all-around structure that gets better as time goes on. So fat transfer in our practice is not equivalent to a filler. It's a comprehensive ability to restore overall facial volume in a permanent way, and also give the opportunity to get better as time goes on as we go. The procedures are done under IV sedation. They're not put under general anesthesia. The way it's injected is using a micro-injection technique where little droplets of fat are put in through multiple tissue planes. And the way I think of it is like snowflakes falling. So if you see individual snowflakes, as they pile up on each other, you have this beautiful smooth contour of snow. That's what I expect to see with our fat transfers. Never in my 11 years and doing thousands of fat transfers have I ever seen a case where a patient has had a lump or a bump or extra fullness in one side of the face or another, or an irregularity, and that's all dependent upon the technique that's performed. And that's what makes fat transfer not only so special, but also so uncommon around the country and even the world, for surgeons who are feeling they can perform it and perform it safely. It requires a lot of experience and a lot of dedicated time to develop the technique necessary to be able to do it well. But when it's done well, it's absolutely gorgeous, and there's no substitute for its ability to augment and restore volume.